Okay, let's begin. I'd like to acknowledge that we're hosting this webinar today on the traditional lands of the Ngunnawal people here in beautiful Canberra. I pay my respects to elders past, present and emerging and thank them for their care of this country. And wherever you, our audience, are watching, listening or presenting from today, I pay my respects to the elders of those lands too, and I warmly welcome Aboriginal and Torres Strait Islander people who are joining us today. We have over 200 people registered to come to join our event today, which is really exciting for us. We have health policy professionals, clinicians, educators, community service workers, consumers and carers. So thank you everyone for joining us. My name is Kate Gorman. I'm the Deputy Director of the Healthcare Consumers Association. It's been my great privilege over the last year and a half to see this health literacy network come together. Today's event is a real milestone in this project. A few housekeeping items just as we begin. We really welcome your comments and your questions today. We'd love it if you could type them into the chat function. Only our presenters will be able to see these, and we'll have time to answer some of your questions a bit further on in our webinar. For those questions we don't get to, we will circulate some questions and answers by email to participants after today, and we'll also put them up on the new Canberra Health Literacy website. We'll be recording the webinar today and we'll send you a link to that as well. And again, put it up on the Canberra Health Literacy Network. This is the first event of the Canberra Health Literacy Network. I encourage you to get involved in this group. This is a network for anyone who cares about making it easier for people in the ACT to get, understand and use health information and make it easier to get the care they need for themselves and their loved ones. We hope you leave today knowing more about health literacy issues in the ACT and how you can make a difference, whether you're a healthcare professional, a community worker or involved in the work of a consumer or self-help organisation. Our speakers today are the ACT Health Minister, Rachel Stephen-Smith, who will formally launch our network, and Professor Kirsten McCaffery, who is co-founder of the Sydney Health Literacy Lab and Director of Research at the University of Sydney School of Public Health. The theme for today's event is Health Literacy, an opportunity for better outcomes for all. In 2019, HCCA spoke to representatives of more than 70 organisations, healthcare providers, community organisations and consumer groups to find out about health literacy strengths and challenges in the ACT. One thing we learnt was that our challenges here in the ACT are much the same as they are Australia-wide. You can learn more about that work and what we discovered on the ACT Health Literacy Network, on the ACT Health Literacy website. As you listen to our speakers today, I challenge you to identify what's working in how you and your colleagues respond to health literacy challenges. And what could you do better? I'd like for you to leave today knowing one thing that you could try in the next 6 to 12 months to improve the way you address those health literacy challenges in your work, or indeed in your life. You can share this with us in the chat function. We would love that, and we'll de-identify and collate the responses and circulate them to the members of the network, and also pop them up on the website after today's event. What you tell us will also help us to shape the future events of this network. So, without further ado, please join me in welcoming the ACT Health Minister, Rachel Stephen-Smith.
Thanks very much, Kate. Just checking you can hear me. Yep, excellent. Okay. It's a real pleasure to be online this afternoon to formally launch the Canberra Health Literacy Network and to be part of this conversation today. I want to start also by acknowledging the traditional custodians of the land that we're meeting on, the Ngunnawal people, and pay my respects to elders past, present and emerging, and acknowledge the ongoing contribution to the culture and life of our city and region of the Ngunnawal people and the diverse Aboriginal and Torres Strait Islander community that has chosen to call Canberra home. And of course, anything we do in health has a particular importance for Aboriginal and Torres Strait Islander peoples who continue to experience a significant gap in health outcomes and life and wellbeing outcomes in comparison to the broader Australian community. The Canberra Health Literacy Network is one outcome of the Community Health Literacy Project, funded by the government under an election commitment in 2016 and an initiative of the Healthcare Consumers Association, which is such an important partner for us in so many ways. The network will bring people together who want to make it easier for everyone who uses health services in the ACT to find, understand and act on health information, to make informed decisions about their health and their health care, and to access health and community services they need when and where they need them. In 2020-21, this financial year, the network will raise awareness of health literacy issues by offering webinars on practical health literacy topics, a network of peers working on in different organisations, and online resources for health and community workers and for consumers. Anyone who works for a health or community service who is involved with a consumer, carer or self-help organisation is welcome to participate in this network, and it's great to see, although we can't see who is online as panellists, I could see when I looked earlier there were 65 people participating today, which is absolutely fantastic. At its core, health literacy is about people's ability to get, understand and act on health information in their daily lives. And this takes confidence, it takes knowledge and it takes skills. According to the Bureau of Statistics, most ACT residents do feel positive about their health literacy, but low health literacy remains a really important public health challenge and barrier to the exceptional health care that we want to ensure all Canberrans are receiving. As many as 44% of ACT residents have a low level of health literacy that can make it difficult to complete everyday health tasks safely. It can be a challenge for anyone at any time, at any stage of their life. And some examples include calculating the right dose of an over-the-counter medication or knowing where to go to get help when you're ill or injured. At which point I would just spruik the nurse-led walk-in centre if you have a minor injury or illness, with the fifth one having opened yesterday in the inner north in Dixon. And while anyone can experience demands on their health literacy, some people are more likely to face challenges than others. Injury, illness, being diagnosed with a long-term health condition, even taking on a caring role. Those can all contribute to a person's health and well-being and their capacity to need to draw on health literacy skills. And I think for any of us who have had any direct involvement in the health system, which is pretty much all of us, we understand that even the most educated, even the most engaged of us in society can face challenges when we start to engage with a health system that is inherently complex and can be fragmented, and where the technical language can be difficult to understand. And we know that those with lower health literacy skills are more likely to be people from culturally and linguistically diverse backgrounds, particularly migrants, recent migrants and refugees, Aboriginal and Torres Strait Islander people who, as I said earlier, already have some of the poorest health outcomes. People with 2 or more long-term health conditions who really need that integrated care, but for whom health literacy is a barrier to a well-coordinated range of supports. Carers and, of course, also people with disability who, again, tend to have poorer life outcomes and health outcomes. And so improving health literacy for all of those groups and more broadly across the community is a shared responsibility. Patients, consumers, health professionals, health policy makers and funders and community workers all have important roles to play. And that's why this network is so important and will add so much value, because it brings those people together to share their expertise and to better understand the barriers to health literacy and how we can all help to support health literacy across our community. Health literacy matters to patients and consumers, and it matters to health professionals. It will actually make providing coordinated healthcare easier if your patient, the consumer and the carer that you're working with are better able to work with you to manage their own health. It's essential for people to staying well, understanding their healthcare options, giving informed consent to tests and treatments, caring for others and staying safe in the community. It also matters to organisations as well as individual healthcare providers. Organisations with high health literacy deliver more cost-effective care and have better staff retention and satisfaction. So fundamentally, health literacy is a key determinant of health. It's a prerequisite for health equity. It's essential, therefore, an essential consideration for policymakers and for those of us in leadership roles across the health system. I've already indicated what an important partner Healthcare Consumers Association is for us, and we know that many people and organisations in the ACT, including the wide range of self-help groups and consumer-run and volunteer-led organisations, do incredible work in this space. Great work to understand and build up health literacy. The Canberra Health Literacy Network gives all of you and all of them the chance to share what you know, learn from each other, and jointly influence how the ACT builds and responds to the challenges of health literacy. I want to thank and congratulate Healthcare Consumers Association and the Network Steering Group, which includes consumer representatives and representatives from Canberra Health Services, Calvary Public Hospital Bruce, ACT Office for Mental Health, Capital Health Network, Carers ACT, and the ACT Health Directorate for your work in establishing the Canberra Health Literacy Network. I'm really pleased, as I said, to be part of the event today, and I look forward to the Canberra community benefiting from this important forum and initiative. And with that, Kate, I'll hand back to you, and congratulations.
Thank you so much for that lovely introduction, Minister. And welcome if you've just joined us recently. I notice we've got nearly 100 people connected to this webinar today now. So you're just in time for our next and keynote speaker, Professor Kirsten McCaffery. Kirsten is a behavioural scientist and a National Health and Medical Council Principal Research Fellow. She has an international reputation in the areas of health literacy, shared decision-making and overdiagnosis research. She's Director of Research at the University of Sydney School of Public Health and co-founder and director of the Sydney Health Literacy Lab. Kirsten will talk to us about why health literacy matters and what we can do about it. As you listen to Kirsten, don't forget to share your questions and comments in the chat function. Tell us what you're doing well. Tell us what you think we can do better in the ACT. And tell us one thing you think you might change in your practice in the next 6 to 12 months. Welcome, Kirsten.
Really fantastic network. Now I'm just going to share my screen and set myself up to go through my presentation. Give me 1 second. Now I just want to check you can hear me okay. Okay, so today I'm going to talk about health literacy and opportunity for better outcomes for all. So just to give you an overview of my talk today, I'm going to give you a Health Literacy 101, so what health literacy is and why it matters, and thank you to Rachel who's already covered much of that material, so I'll go through that quickly. I want to give an example of why health literacy matters, a relevant one which relates to some recent work I've been doing in COVID-19 and health literacy. And then I lastly want to talk about what we can learn from health literacy research about how to communicate more effectively to our community. So first, Health Literacy 101. So health literacy is the cognitive and social skills which determine the motivation and ability of individuals to gain access to understand and to use information in ways that promote and maintain good health. And importantly, it means more than being able to read pamphlets. By improving a person's access to health information, their capacity to use it effectively, health literacy is critical to empowerment. And it's important to note that health literacy is content and context specific. So even when a person has advanced literacy skills, their ability to obtain, understand and apply health information in a particular context can be poor. I like this model of health literacy which shows 3 levels of skills that you need to be health literate and function effectively in a healthcare setting. So at the base is functional health literacy, and these are the reading, writing, numeracy, and oral skills that we traditionally associate with literacy. The next level is called communicative and interactive health literacy, and these are seen as more advanced cognitive and social skills which people need to be able to communicate about their health and explain their symptoms and negotiate with healthcare providers. And then at the top is described as critical health literacy, and this is seen as the most advanced health literacy skill, and it's the ability to analyse and then act on information. And all these 3 levels are seen as crucial to becoming a health literate person. Oh, sorry, I've gone the wrong way. But health literacy is not only made up of an individual's literacy skills and capacities, like those I just showed you in the previous slide. It's also affected by the demand placed on the individual by the environment. Now, we know from Australian Bureau of Statistics data that a high proportion of the population have inadequate or lower health literacy, lower than would be desirable. So data collected in 2006, which is the most recent performance-based assessment of health literacy in Australia, showed that 59% of people had inadequate health literacy, and that lower health literacy was associated with lower levels of education, a language other than English spoken at home, being from Aboriginal or Torres Strait Islander backgrounds, and being older age, as well as other factors. We also know that the health literacy environment is too demanding for most consumers, and there's a whole raft of research which has analysed the demand placed on the individual by the health information environment, and that shows that between 60 and 95% of health information that is provided to consumers and patients is too complex for people with lower literacy. So we have a real problem here. We have a high proportion of people who have suboptimal health literacy skills, and we have an health information environment or health literacy environment that is not suitable for them, that is too complex. This slide gives a bit more detail into the models I've just shown you. I think on the left describes health literacy and gives the different levels of health literacy that I talked about, but also includes, brings in the idea that stress, fatigue, also illness in this orange arrow here, can also strongly influence a person's skills and ability at any given time to understand and act on health information. It also gives a broader range of factors in the health literacy environment that affect the demands and complexities of that environment, and that includes the healthcare system, how it's structured, financial resources, the social supports that are available, and of course the health resources, so the health information that's around. So why does health literacy matter? Well, we know that low health literacy is associated with poor health independently of all other known risk factors. So low health literacy is associated with higher rates of chronic disease, higher rates of mortality, higher hospitalisation rates and use of emergency services, lower rates of preventative services such as screening, poorer self-management skills, greater medication errors, lower levels of knowledge about disease, and lower ratings of satisfaction with doctor-patient communication. And this has been well summarised in several systematic reviews. We also know that health literacy costs billions. And from research conducted in the UK, it accounts for between 3 to 5% of all healthcare costs. So that's estimated to be 2.8 to 5 billion pounds per year. We know in Australia there are increased out-of-pocket costs for people with lower literacy. And we also know, of course, that the cost to health and quality of life is huge. So I now want to switch to an example of some work that I've been doing in relation to COVID-19 and health literacy to show you really another example of why health literacy matters. So this work originated from concerns early on that much of the prominent state and national public communication and messaging around COVID-19 was not designed for a diverse and hard to reach and low literacy audience. And myself, Jan Donovan from Consumers Health Forum, Danielle Muscat wrote about this in late March, early April, and we published it in Croaky. And it's since been, and others have since commented on this and also noted that, made the same points publicly. So what we could see from then, and we still continue to see, is much information presented on COVID was online, it was static or web-based content, and was written at a level too complex for even average readers. And this has since been shown in a nice paper by Mishra et al. Recently published, which compares the readability of official public health information about COVID from websites and documents around the world, including in Australia. And it seems that the health literacy skills of the community are not being well considered in the information provided about COVID-19. We also know that there have been problems with translated government communication resources, and those that were available may have been underutilised. And this seems to have resulted in people finding other non-government resources to fill the gaps in understanding. And this, for migrants particularly, has included information from their home countries, which may not be relevant to life in Australia. So in April, we launched the SHELL, so that's the Sydney Health Literacy Lab COVID survey. It's a survey of knowledge, attitudes and behaviours. On COVID, we used an online survey methodology, and I've listed all of the team members on this project. And what we did was we recruited people online and via social media. And we had a baseline survey which had over 4,000 participants, and then we've run further monthly waves of the survey to follow a subset recruited by social media. We've had over 1,000 responses to each survey. I should note before I go on and tell you what we found, that we have some limitations to our survey. We had to create it very rapidly. We had no funding, so our sample is limited. It's not nationally representative. We recruited people online, and our measure of cultural and linguistic diversity is limited to primary language other than English spoken at home. So there are some important limitations to this work, but I think it shows some important findings. So to cut to the chase, what our survey showed, so these are the results first of our baseline survey, which was carried out in the middle of April with over 4,000 respondents, was that people with lower health literacy and those who spoke a language other than English at home had poorer understanding of COVID symptoms, were less able to identify behaviours to prevent infection, and experienced more difficulty finding information about COVID-19. People with lower health literacy, and again, those who spoke a language other than English at home, were also more likely to rate social distancing as less important. And they were also more likely to endorse misinformation and conspiracy beliefs about COVID-19 and vaccination. So then, in our next piece of work, we analysed data from 3 surveys. So from the May and June survey, as well as our baseline April survey. And we looked at support of misinformation and how that had changed over time, or looked at the associations over time. What we found in that analysis was stronger agreement with misinformation, still associated with health literacy and language other than English spoken at home, was also associated with younger age, a male gender and low education. And we also found that misinformation beliefs were associated with lower digital health literacy. So that's the skills and capacity to search for online health information. Lower perceived threat of COVID-19, lower confidence in government, and lower trust in scientific institutions. So in summary, what we see from this work is that there are important disparities in knowledge, attitudes and behavioural responses by health literacy and language spoken at home, and as well as other risk groups such as young people. Worryingly, we see endorsement of misinformation beliefs consistently reported over 3 months, and again associated with health literacy, language spoken at home, as well as education, gender and younger age. And this corresponds with public health communication gaps about COVID-19 that we raised and others have raised really quite early on in the campaign. This is concerning because it does have potential to undermine efforts to reduce viral transmission. It may lead to social inequalities in health outcomes in Australia, and we have seen inequalities in health outcomes in the US and in the UK that have been carefully documented. But I note that our limitations to this work, it's not nationally representative. And our sample of participants who spoke a language other than English, is small. But we need more work in this area. And we're now working with the Western Sydney LHD Multicultural Health Service to extend our survey to people with from culturally and linguistic backgrounds. So we hope to have more data to present from this group soon. But so I think that gives a nice example of why health literacy matters and why it affects us all, in fact. But what can we do about it? This is the crucial thing. And what can we learn from health literacy research about how to communicate more effectively? Well, actually, we can learn a lot. There's a lot we can do. It feels like we're doing this, we do this a lot, and it feels like we're doing this with COVID-19. But really, we can do many things, and I want to tell you about some of them. So this slide gives you a summary of what I'm going to go through relatively quickly. So we can use evidence-based interventions that work, and all of these hexagons represent bodies of work where we have shown improvements in outcomes for people with low health literacy. So that includes written health information, prescription drug labels, verbal communication, risk communication, shared decision-making, and engagement with the education sector. So improving written health information. We know that use of plain language improves understanding. That has been well shown. We can avoid jargon words. You see this website here, it's a list of medical words that have a replacement with a much simpler version or everyday word, which is incredibly useful and we should be using in all our health communication. We should avoid words with 4 or more syllables. We should write text at grade 5 reading level. So that's written for an aged 11-year-old. We should use simple font, Arial or sans serif, and we should avoid capitals. We should use lots of white space. We should break up text and have a strong contrast between the text and the background. We should have 3 to 5 main points maximum per document. We should put essential information first. And what we do know from the literature is that if people find text easy to read, they're more willing to comply with the behavioural advice, and they're more likely to judge the information and source of that information favourably. So it matters how we present our information. We also need to pay attention to images. They must, of course, be culturally appropriate, and they also need to be interpretable without text. I want to give you some example here. Here's an image on the left, which is about eating a piece of meat that's the size of your palm. Now, this is relatively easy to interpret from the visual. Now, the image on the right is about eating low-salt foods, avoiding low-salt foods. But how would you know whether you were to eat or to avoid those foods? And of course, they're very culturally specific as well. We can also improve communication of numeric health information. Again, there's a nice body of work which shows that presenting numeric information in tables or pictographs, not text, helps understanding. Presenting numeric information in a logical order for evaluation, so the higher number being better, for example. Presenting information with a consistent denominator, using natural frequencies such as 1 out of 100, or simple percents such as 1% to help people understand risks and benefits. Avoiding decimal places and rounding to base 10 if that's appropriate. Also, adding video to verbal narratives helps. There's also an excellent body of work from prescription drug labels which is about making content actionable and instructions clear and precise. And what this body of work shows is that if instructions are precise and explicit, drug label errors reduce. And in this study, they reduced from 50% to 11% in a low literacy population. And so in that study, they changed the instructions from those on the right under the red cross, which said take twice daily or take every 12 hours. They changed them to take one at 6 p.m. and one at 6 a.m. and one at 6 p.m. every day, or take one with breakfast and one with dinner. And they showed that level of reduction in drug label errors, which is impressive. In terms of verbal communication, we can use teach back. We know that patients remember and understand less than 50% of what clinicians say in reviews that have looked at this. Teach back is a method where a healthcare provider asks patients to explain in their own words what they need to know or do in a caring way at the end of the consultation or interaction. It's very important to make sure that it's asked in a caring way and is not asked in a way to test the patient, but more asked in a way to test the skills of the healthcare provider's communication. But we know in research, and some of our own research has shown that using teach back improves patients' or consumers' understanding of what steps they need to follow, and also that it can improve their trust in the advice that's been given. In terms of communicating risk, we know that we can use formats that improve understanding. So on the left, I've got an example of a pictograph where we're showing 5 out of 100 women will experience side effects, or 5%. We know this format is better understood than if you use pie charts or bar charts or relative risk formats. And we also know now that there's good evidence that shared decision-making can improve outcomes for patients. That means improving patients' knowledge, their risk perceptions, reducing uncertainty, increasing participation in decision-making, can lead to more positive doctor-patient communication. And in fact, research also shows that the impact may be greatest in lower literacy and socially disadvantaged patients. And finally, in terms of the evidence of what can work, we know that we can engage with the education sector. There's again now a body of work which shows that health literacy programs, some conducted in Australia that I've been involved in, there have been others in the UK and others in the US, now show that you can improve health literacy in the community among people with lower basic literacy and numeracy skills. There's also some excellent work in schools which shows that you can teach children, and this study by Nasangi was conducted in Tanzania. You can teach school children skills in numeracy and health literacy that they can carry with them. So as I draw to a close, I wanted to bring up here, I'm coming back to COVID-19 now because it's such a we're all facing this every day, I think. And I recently took my son to be tested for COVID, and I had to have a test too. And I was given this leaflet by New South Wales Health. And I don't want to single out New South Wales Health for bad behaviour because, you know, it's similar to other documents produced all over Australia and in many places of the world, actually. But I just wanted to put it up and say, you know, thinking about the advice I just talked about and what we can do to improve information, what improvements could we make to this document if we followed health literacy advice? I suggest that we could make many, many improvements. And I just want to give you some examples from the WHO where perhaps out of all of the organisations seem to be applying health literacy principles a bit better than other organisations. And I ask you, you know, if you're stressed and tired and got a child screaming in your ear, which document would you rather read? You know, these or the ones before? I know which I'd rather read. But now just in my closing, as I went through, there is lots of evidence. There are lots of things that we can do to improve the way we communicate to the community and to patients, to improve understanding and to enhance the equity of access to health information. But we now face an added challenge, and this is a challenge we are less prepared for. We face the challenge of YouTube, Instagram, TikTok, social media, and the online world. And this is where we need to invest our resources and our attention to working out how we can better communicate health information to our young people who rely on these sources of information. And we've seen that, as I talked about, the misinformation in COVID and how that is prevalent in younger age groups. We know that's because they're getting their information from these sources, and it's very hard to distinguish good quality information from poor quality information. So this is a challenge for us, but I feel like we should at least be able to apply the principles that we know to the content that we can to take us forward to improve everyone's health literacy. And it feels like good health literacy has never been so important. So with that, I think I'll finish and happy to take any questions from anybody.
Thank you, Kirsten, for that fascinating presentation. I do have a number of questions and a couple of reflections that have come through while you've been speaking. So let me go to those. So my first question, we have quite a few people joining us today from the community services sector. Much of what you've said today relates to people working directly in health services. Do you have any advice for people who are community service workers? What can they do to support people's health literacy?
Well, that's a great question. I think you need to look at the information that you provide to your clients. I did some work with iCare, interesting. I know iCare's been in the news a lot, but iCare wanted us to look at the information they provide to their clients on how they access support, how they access the programs, and it was quite staggering how limited the information was for even with people with average reading skills. So what I would suggest you do is go to any of your client-facing information or websites and look at whether they're designed to meet the needs of people with lower literacy or even average literacy skills. And there are there's lots of guidance on designing websites and writing text, some of which I gave you over that talk about how you can make things easier to read. And again, you can also use Teachback in the same way when you're talking to clients. You know, can I check with you? You understand now, or you know what we should do, what you need to do next to get from A to B or to achieve X. So I think it applies.
Thank you. So my next question is, why do you think socially disadvantaged people are more likely to believe COVID-19 misinformation and less likely to socially distance? Is it just a lack of understanding?
Well, I think we need to understand far more about this. What I think is clear is that the health information that's provided at the moment is written at a level that is beyond even the average level for an average reader. So we're not doing well in making our information clear and understandable for a broad audience. So that is one fundamental screaming problem that we can see and that we can correct. Now, I think the endorsement of misinformation is much more complicated than, of course, than just being able to read text or not. It's about trustworthy sources. It's about credibility. We do know, for instance, that the public health messaging about COVID has not been designed for young people. It's not using the sources that they find credible. It's not using communication channels that they typically use. And I think that's showing up in the data. I think we need to do much more work, but I think as first base, really, we should be writing the information at a level that the majority of the population can understand.
Thank you. So another one is, you've talked about the 2006 health literacy statistics. When can we expect new data? Do you know?
Yeah, that's a great question. That is a great question. So the latest, the ABS did, they did another health literacy survey. I think it was a year ago or possibly 2 years ago now. And they used a different question format. So they used something called the Health Literacy Questionnaire, which was designed by Richard Osborne from Melbourne. And this questionnaire, whilst has many strengths, is a self-reported measure of health literacy. So it asks questions such as, do you feel you know where to look for your health information? Agree to disagree. Do you feel supported in your health information? So whereas the 2006 data was actually gave people information like a bus timetable or a drug label and asked people to interpret that information. So it was more like a kind of an objective test. So whilst there has been more recent data, it's impossible to compare those two sets of data, really. So I believe, I mean, I think one represents an overestimate of health literacy, which is the recent data, and probably the 2006 data represents the worst or the most challenging data, if you will, because usually you might have someone with you to ask and say, I don't understand this label, can you help me? You know, we don't all live in a test setting. So it's quite difficult to find the best data to present there. I just hope that in future ABS have a bit more funding to be able to do the more objective measures, which require a face-to-face assessment.
Okay, here's another good one. What's the main thing you'd say consumers need to do to get what they need from the health system?
Oh, that's a great question. I think the Ask, Share, Know questions, which I didn't put up. I don't know if you've heard of Ask, Share, Know, but it's a fantastic website and it has 3 questions for consumers to ask their healthcare provider. What are my options? How does the evidence, or how do these options relate to me? And I can't even remember what the third one, the third question is, I'm sorry. But they're great questions that you can take to your healthcare provider to ask to help you make an informed decision. Choosing Wisely also have a similar set of questions. They have 5 questions, and I definitely can't remember all of those 5 off the top of my head. But I think giving people the skills and confidence to ask questions at every opportunity is I think the best thing that I would recommend.
Thanks. Yeah, I think we couldn't agree more. This next one is actually a reflection. Someone's written, health literacy is about more than functioning in the healthcare setting. It's also about health information in daily life. We know that people with high financial literacy don't always make good, sound financial decisions, and the same is true of health literacy. So we're now getting a lot of great comments and questions coming in through the chat function, and we're not going to have time for all of them today. So for those we don't get to, we will send around the questions and answers by email and link it on the website as well after today. All right, so thank you very much for that wonderful talk and field questions, Kirsten. Before we close today, would any of our panellists, Minister Rachel Stephen-Smith, would you like to make some final remarks before I say a few things to finish up? Or you, Kirsten?
Thanks very much, Kate. I just wanted to say thank you to Kirsten. That was a really great presentation. Really summed up, I think, a great starting point for this conversation for the network. Summed up some of the things that will be ongoing topics of conversation, no doubt, and certainly gave me some food for thought as well. So thank you to Kirsten, and thanks again to HCCA for organising this.
Thank you very much, Minister. It's a great pleasure to have you with us today. So our time together now is drawing to a close. We'd love it if you would take the time to complete the quick feedback survey on today's webinar. We're putting a link to that in the chat function on the bottom right of your screen. So when it's time to go, we'd love it if you could just click in and answer a few questions for us as you go. And the survey will also ask you about your thoughts for future network events, because we really want this network to be shaped by you, our participants. And I know that I've mentioned it a few times, but before I go, I just want to remind you about our new Canberra Health Literacy website. The website's another part of this project, and it's designed to be a place for information, tools and training for health literacy in the ACT. So we hope that you will become users, contributors and champions of this site. And although it's still in development right now, we invite you to visit it, take a look around and tell us what you think. We'll send you a link to the site in the follow-up email from today. Also in that email will be an invitation to join the Canberra Health Literacy Network and a link to the recording of this webinar and the questions and answers from today. So keep an eye out for that in your inbox. Once again, thank you for your interest in health literacy and for being here with us today. We hope to see or hear from you online. And I'm going to leave you with one more quote that I picked up out of the chat function. And it says, "COVID shows us that health literacy is not a big enough priority. I'd like to make it the forefront of my role." And I hope you feel that way too. Thank you and goodbye.